What's up, everybody? It's your boy Dr. G, aka Med Hustle. There's a lot of medical students about to start residency on July 1st, 2022. It's a big day, it's scary, there's all the different specialties, there's surgical, there's non-surgical, etc. It's a very intense time and a big transition in life. And I'm currently in my final year of internal medicine residency, and I just wanted to touch base with all the incoming internal medicine residents to give you a little glimpse about what you should expect and what are the best ways to make you the best doctor that you can be. Transitioning from fourth year medical student into an intern is a big shift. It's a high learning curve, very steep learning curve, and it's very time and energy consuming. You need to be in the best shape of your life, in my opinion. You need to be optimized from a physical standpoint. So, first of all, make sure you get a nice fat vacation under your belt. Make sure you get a nice fat chill session and get away from all the medicine. Just relax, recalibrate, see a new part of the world that you've never seen before. That is very important, in my opinion, to just come into residency brand new, fresh, ready to go. It's going to reinvigorate your excitement and get you ready to go. Step number two. Step number two is optimizing your physical fitness. I recommend everybody coming into residency, whether it's surgical or non-surgical, to be at your peak physical condition. If you're overweight or obese, get on it. If you're kind of been slacking, chilling too much, just lost your energy and you can't do 4 mets, get on it. And the best thing I recommend for anyone in fourth year is start doing cardio, get on a treadmill, go on a walk, start running, start swimming, start lifting weights to get your bones stronger, get your muscles stronger. All this physical fitness will clear up your head so much and it'll put you in tune with the heavy schedule that you're going to be working in. Step number 3, be excited. A lot of people are coming in where their fear ratio is 90% and their excitement ratio is 10%. You have to tip the scales in the other direction. It's okay to have fear. It's okay to be anxious and worried about the unknown, but you have to be so excited and remember, you are in a position to uplift other people. A lot of people live in the fear dynamic so deeply and so much anxiety and worry that they're going to make mistakes. Of course you're going to make mistakes. Of course you're going to do foolish things. Of course. But that doesn't mean anything. You have to trust the process. You have to appreciate the path of medicine and what it takes to be a practitioner, a strong artist of medicine. It takes mistakes. It takes a lot of learning. So drop the fear. Just forget about it. There's nothing you can do. If you lose sleep, you're anxious. What's going to happen? What's going to happen? Nothing is going to change if your anxiety continues. So it's okay to have a little worry and nervousness. That's going to keep you on your tippy toes to perform well, but don't let it cripple you. Don't let the anxiety cripple you from taking action, making decisions. When you're a fourth year medical student, you're kind of making decisions. You wonder if they really take your opinion seriously. You offer a piece here and there of the plan. But when you're an intern, you're going to be running a lot of decisions, fast-paced, and it's going to be meaningful. It's going to have an impact on somebody's life. Don't worry, there's going to be supervision because all my interns, whenever we're rotating on the medical wards, I double check everything, I scan everything, I make sure they're good, I make sure the patient's good. So don't fear making mistakes because there is checks and balances. The senior resident and the attending and the nurses will often call you and say, are you sure you want to order this? Are you sure you want to give this much medicine? Are you sure you're planning on this? So people will check you and that's okay. Enjoy the process. Step number 4, I recommend that any patient you see, do an up-to-date real quick. You got a patient with pancreatitis, up to date. You got a patient with hyponatremia, up to date. Every patient you see, up to date something about that patient and read a nugget of information about them. That is the best thing you could do when you're on the medical wards. If you're so unfortunate to be starting residency in the ICU, in my opinion, that's not the best position to be in because you don't have any knowledge about medical complexities, so a lot of things will go way over your head. The pressors, the central lines, the types of medications, the complexity of diseases, the tube feedings, the vent settings, all that, in my opinion, will go, unfortunately, down the drain. It'll be a nice exposure. Some people say it's good, you get it out the way, but you're not going to capitalize on the learning experience if they put you on ICU in the beginning. If you have any authority over your schedule, try to put ICU in month number 10, 11, or 12 of your intern year. Not 12 because that's going to be in the summer. You want to chill in the summer. So that's the early ICU. I'm against it. Number 2, a good schedule to start on is night float. Night float is when you don't have to round. You have a lot of autonomy and you have a senior resident or residents with you who are going to teach you how to use the computer system. The first few months of residency is learning how to use the computer system, how to optimize your efficiency in the computer system to see patients. The whole goal of residency is transition from needing a lot of computer time to needing the least amount of computer time to make decisions and get patients in and out of the hospital in a safe, efficient manner. That is the whole priority. So if you have night float in the beginning, you don't have to do rounds in the day. You don't have to waste time on, teaching and talking and things like that. So you spend time learning the computer. So when you come out of the Groundhog Day, when it's Groundhog Day and you come out of the underworld, the dark side of the world, you're going to be efficient and ready to round on a lot of patients. At night, you're not really seeing as many patients as the daytime. Depends on your program, but the style of patients you see is much different. It's all admitting patients. You learn how to put in the admitting orders, the DVT prophylaxis, how to restart prior to admission medications, how to screen and reconcile prior to admission medications, how to put your note together and make it look very standardized and succinct and efficient, and how to communicate with other team members. Whether you guys use secure chat or other mechanisms or pagers, you're just learning the technicalities. So being able to spend time learning technicalities is a great thing in my opinion. Another good thing to start on is an elective. Hopefully it's not an important elective or an elective that you want to do a fellowship in. Hopefully it's an elective that it's moderate amount of learning. You get some off time, you get the weekends off, and you get time to learn the computer system. It's not going to teach you how to manage the wards, but you're going to get a glimpse from the outside as a consultant, whether it's pulmonary, endocrinology, nephrology. I don't recommend nephrology off the bat because, once again, nephrology has very deep, complex, intricate pathophysiology lessons that you don't want to go over your head as a wasted first year piece. You don't even know what diuretics are coming into residency. You don't know how to use them. So those pieces and dialysis and CRRT, you're going to get consulted in the ICU to consult for CRRT, removing fluid, and just managing complex electrolyte disturbances, hyperkalemia, things of that nature. You don't want that off the bat because it's going to go over your head. At the end of the day, you're going to get exposure to a lot of things. You're going to be a good doctor, so the order doesn't matter, but these are my personal preferences in my opinion. Now, the art of medicine is the most slept on piece of advice that nobody talks about. Becoming the artist doctor. You have to be an artist at your craft. It is so slept on. Nobody talks about it. Nobody really encourages residents to do it. But the art of medicine will make you stand out leagues ahead of your colleagues. So this is the art of medicine is the following. 1. Be friends with your patients. Do not make your patients a client. Do not make your patients a customer. Make your patients your friends. And there's a nuance to the word friends here. What it means is make them believe that you have their best interest in mind. And the way for them to believe that is if you truly have their best interest in mind. When you're overwhelmed and flustered and you don't know what you're doing and you just want to please your senior resident and you're attending and trying to look good on paper and try to be a good team member, all those pieces distract you from trying to look good to your patient. What you want to do is earn the trust of your patient. Tell the patient, I got your back. Tell the patient you're going to make sure they get the best quality of care no matter what the obstacles are. Make sure your patient doesn't suffer in pain. Make sure your patient doesn't go NPO without food or drink for too long unnecessarily. Make sure your patient, if they're cold, don't go back to the resident room and page the nurse saying, hey, they need a blanket. Get the damn blanket. Okay? So all these little pieces, if your patient is scared, sit down and reassure. If your patient's kind of quiet and things like that, crack a joke. Try to get to know the patient. If you can't crack a joke with your patients, you're really keeping it in a business formal relationship. They won't tell you anything about their medical history. To me, that's the most important piece of being a doctor. It's not learning how to present or how to write the notes for the billing stupid insurance companies so the hospital gets paid. That is not the roots of being a good doctor. It is the new age platform of being a doctor. You got to learn how to write notes. You got to learn how to present your patients. But these come with time and you don't have to rush it. But focus on being a good doctor. Learn good exam skills. Learn to catch murmurs early. Try to catch a murmur all the time. Learn to do a strong abdominal exam. Learn to rule out peritoneal signs. Learn a good neurologic exam. A strong neuro exam will carry you so far in residency, and it's very imperative that you get these things down. So these are the things I would work on as a new intern and try to be good at. And the documentation, all that stuff, it comes with time. Here's a big trick. If your documentation software has dictation, so if you can use for my program it's called Dragon, so you just dictate in the microphone and everything types out. It has artificial intelligence and it uses very sensitive sensors to really catch the words you're speaking. This is a game changer. This is a life changer. It's gonna break you out the mold. You don't have to type. You're not gonna get calloused fingers. You're not gonna get carpal tunnel. You just start dictating. It's a steep learning curve at first, but learn it early because you're gonna need it, and you're gonna crank out notes like it's nothing, like it's baby oil. So you should use the dictation software. Get used to it early if you have access to it. These are some of the prime tips that I can think about off the dome right now. If you have any questions or concerns, drop it in the comments. Feel free to follow, subscribe to my page, because I'll be dropping a part 2 with more high yield information. Thanks for tuning in. I appreciate you and best of luck on your journey. Feel free to hit me up anytime if you get scared or have questions. I got your back. Med Hustle, Dr. G. Peace.